Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I'm here today with Amy Holmes about her upcoming presentation, Updates in Pharmacotherapy for NAS. Welcome, Amy.
Thank you.
It's so good to have you here with us today, and we're very excited about your topic. The topic will be, or the presentation will be part of our Gold Neonatal Online Conference 2018. So before we jump right into the topic, tell our listeners a little bit about yourself and your professional journey.
Sure. So I am a pharmacist from North Carolina. I have been in practice for over 20 years, and I've worn a lot of different hats as a pharmacist, but my passion I have found is in the neonatal ICU, where I've been practicing now for almost 11 years. I am just inspired by tiny patients and intrigued by all the things that we still can learn about treating them, and it's been the best part of my career so far.
That's wonderful. Thank you for sharing that with us. And now let's look at your topic here. It's your title is the updates in pharmacotherapy for NAS. So tell us first of all, what is NAS? And this is for our listeners who maybe are not in the field, just to know what it is. And how did you get interested in the topic and presenting on it?
Sure. So NAS is neonatal abstinence syndrome. So babies who are born to mothers who have substance use issues or in treatment for substance use with methadone or buprenorphine, babies experience withdrawal, and that's known as neonatal abstinence syndrome or NAS. And it really became a passion of mine specifically within NICU. I think because as a pharmacist, I felt like this was a situation not only that did we use drugs to treat it, but actually caused by drugs. And so it just seemed intuitive to me that a pharmacist really needed to be involved in the care of these patients. And I've had a lot of opportunities within my unit to be involved in multidisciplinary approaches to management, including developing protocols and quality improvement initiatives, working at the bedside day to day, helping to provide the best care for these babies. And so just over time became something that was passionate to find the best treatment and stay in touch with all of the new literature coming out, and just being engaged as much as I can in this disease state.
You mentioned something there that was very interesting to me. You said it's caused by drugs, NAS is caused by drugs, and we're treating it with drugs. So that was an interesting viewpoint. I had not thought of myself looking at it like that, and you're absolutely right about that. And now, here in the US, we experience an opioid crisis. Right now, we have it's in the media and it's in the news a lot. Have you yourself seen an increase in the NICU with cases of any?
Definitely,
Definitely, right?
definitely. Unfortunately, we do see more babies, it seems like every year.
Right. Yeah. It is such an important topic to cover, and I am looking forward to learn more about this in your presentations here. Before I let you go, what is it that you would like our delegates to take away from the presentation?
Well, like I said, I think it's important to stay on top of all the current literature, and that's what I am looking to do here is review some new approaches that have come out for managing neonatal abstinence syndrome, some different approaches that have been shown to decrease the length of treatment, decrease length of stay. Sometimes when we're used to treating something a certain way, we stay on where we're familiar. And so this is just to challenge folks to take a look at new information and what new treatment approaches might be applicable in their units to better care for these babies.
So it's absolutely wonderful. New ways of treating, new methods that are out there and that are help decrease the length of treatment, as you said. I can't wait to hear that presentation, Amy. Thank you so much for spending time here with us today and chatting with me about the upcoming topic, updates in pharmacotherapy for NAS. And as I said, this presentation is part of the Gold Neonatal Online Conference. And Amy will be presenting live on June 11. And for more information on this presentation, when it's being held in your time zone, and this is to our listeners, and on the other presentations in the Gold Neonatal Conference, please visit goldneonatal.com. Thank you again, Amy.
Thank you.
And bye bye to our listeners.